Hello everyone, welcome to Nurse Bestie Explains. Today we see the continuation video of Research Approaches and Designs Part 2. Types of Research Design. So research design is divided into quantitative research design and qualitative research design. Two types of research design which we have seen in the previous video. So coming to the classification of each design. Quantitative research design is classified into three. They are experimental, non-experimental and other research designs. In experimental, three types are there: true experimental research design, quasi-experimental and pre-experimental. In non-experimental, different types of research designs are there. They are descriptive design, correlational design, developmental, epidemiological and survey research. These are all come under non-experimental. Other designs like methodological, meta-analysis, secondary data, outcome research, evaluation studies and operational research. So this is the classification of quantitative research design. Coming to the qualitative research design, you know the difference between quantitative and qualitative. Qualitative research designs include phenomenological studies, ethnographic studies, grounded case studies, historical research and action research. These are all designs come under qualitative research design. Let's start with the first one, that is quantitative research design. In that, first one is experimental research design. In this video we will see the three types of experimental research design: two experimental, quasi-experimental and pre-experimental design. So coming to the quantitative research designs, types are experimental, non-experimental and other additional designs. Experimental designs are divided into three types: true experimental, quasi-experimental and pre-experimental design. Coming to the first one, true experimental research design. They are those where researchers have complete control over the extraneous variables. Okay. So in true experimental research design, where researcher, the person who is doing the research, will have complete control over the extraneous variables in the study. In her research problem, she will have control over the extraneous variables and can predict. Okay, she can predict confidently that the observed effect on the dependent variable is only due to the manipulation of independent variable. Okay. So in this type of studies, what happens? Everything is under complete control of extraneous variables in the hands of researcher. So the researcher can predict, she can guess what happens at the end of study confidently, that the observed effect, whatever effect she is observing on the dependent variable. For example, effect of music therapy on decreasing anxiety levels among the patients after cardiac surgery. So how the music therapy is affecting the cardiac surgery patients post-operatively to reduce the anxiety levels, that she can easily predict confidently. It is only due to the manipulation of the independent variable. The essential characteristics of true experimental design are: a true experimental research design must essentially consist of following three characteristics. They are manipulation, control and randomization. What are these? First one is manipulation. It refers to conscious control of the independent variable by the researcher through treatment or interventions to observe its effect on dependent variable. Okay. So independent variable is music therapy. Music therapy, it will not change. You will provide music therapy to a group of people. Okay, by the researcher through treatment or intervention. That music therapy is nothing but a treatment or intervention. What it helps you to observe its effect on dependent variable. What is dependent variable? Anxiety level of the patients who has undergone cardiac surgery. Okay. So that conscious control is called as a manipulation. It is in the control of the researcher. So that is manipulation. Another one is control. Control refers to the use of control group and controlling the effects of extraneous variables on the dependent variable in which researcher is interested. Okay, having control group. In some researchers, what happens? Researchers like they select two groups: experimental group and control group. Experimental group, where They provide music therapy to those patients and they check how it is affecting their anxiety levels. Other group will be control group where no music therapy will be given. Okay, it is control group, no therapy will be given, but they check for their anxiety levels post operatively after the cardiac surgery. So like that, one control group will be there, how the extraneous variables are under control and they affect the dependent variable, that is studied in control group. Third factor is randomization. It means that every subject has an equal chance of being assigned to experimental or control group. This is also known as random assignment of subjects. Okay, that means, for example, you are selecting 60 people. Okay, 30 in experimental group and 30 in control group. How you will select? All 60 people names you will write down in the chits or names or numbers. You will keep in a container. You can use any method like taking the chits, selecting chits, all chits in one container, select each like that. Whichever chit you are selecting, all will go into the experimental group. The leftover chit people will go into the control group, like that, because all 60 members have equal chance, they all have equal chance to be participated in both the groups. So like this, without any bias. Okay, you will not show any bias whom you want to include in experimental group and in the control group, without any partiality, properly you can do. Okay, so that, like that, that is called as randomization, randomly in putting the people in experimental group and control group without your interference. Okay, that every subject, every participant in this research has equal chance to participate in the research, which involves the placement of study subjects on the random basis. Because one person is my relative and I know that patient, so let me keep in experimental group so they will be benefited. Like that, you should not show any partiality. Everyone will have equal chance. Through random assignment of subjects under experimental or control group, chances of systemic bias is eliminated. Okay, so bias is eliminated. Partiality, that feeling or that manipulation can be eliminated if you randomly assign the subjects to the both the groups, experimental group and control group. Okay, so these are the three characteristics of true experimental research design: manipulation, control, and randomization. Next, types of true experimental design. There are 6 types of true experimental design are there. Post-test only design, pre-test post-test only design, Solomon 4-group design, factorial design, randomized block design, and crossover design. Let's see the first one, post-test only design. This design composed of 2 randomly assigned groups. Okay, 2 groups are there. You can see in the picture random allocation of group A and group B. 2 groups, that is experimental group where you give treatment. This group is called as experimental group. Another group is the control group where no treatment will be given. Okay, but neither of which is pre-tested before. So for both the groups there is no pre-test. Okay, you don't do any pre-test or any data you collect, just you include them in the treatment, experiment group and the control group. Okay. In addition, while treatment is implemented on experiment group only, post-test observation is carried out on both the groups to assess the effect of manipulation. Okay, only one group you give the treatment, other group no treatment, but you will conduct a post-test in both the groups. Okay, you can see here post-test is given, measurement is done in both the groups. Okay, and there will be some particular time will be allotted. That's why this design is called as post-test only design. No pre-test here, one experimental group, one control group, but post-test is there for both the groups, but treatment for only one group. That's why it is called as post-test only design. Next, pre-test, post-test only design. In this, subjects are assigned to control and experimental group. Okay, here randomization, experimental group and control group. Intervention nothing but treatment. Experimental group, control group. 2 groups will be allotted. The effect of the dependent variable on both the groups is seen before the treatment and later the treatment is carried out on experimental group only, and after treatment observation of dependent variables is made on both the groups to examine the effect of the manipulation of independent variable on the dependent variable. Here pretest will be conducted for both the groups. Pretest will be conducted. For experimental group, program, okay, some treatment or some structured teaching program, like taking a class on some topic to improve their knowledge, like that some program will be conducted and post test will be done. But for control group, pre test will be there, post test will be there, but there is no program, okay, no educational program or any treatment intervention, okay. This is called as pre-test, post-test only design. Next, Solomon 4 group design. There are two experimental groups, E1, E2. Okay, here you can see E1, E2, group A, B, E1, E2, experimental group 1, experimental group 2, group A, group B, and two control groups. Okay, group A, group B, C. Okay, C1, C2. Initially, the research randomly assigns. Here also randomly they assign the subjects to the four groups. Out of four groups, only E1 and C1 receives pre-test. E1 and C1, only these two groups receive the pre-test. Okay, no pre-test for E2 and C2. Okay, only two. Okay, from this one group will receive the pre-test. Finally, all the four groups receive the post-test. But at the end, all the four groups receive the post-test. Post-test where the effects of dependent variable of the study are observed. How the dependent variable changes is observed and compared, made of four groups to assess the effect of independent variable on the dependent variable. But for the two groups, they will give treatment and post-test will be conducted. Here, no treatment. For control group, no treatment, but post-test they will conduct it. Please remember, not pre-test is not conducted for all four groups. Only one from experimental group, one from control group. Only pre-test is conducted. Then they will do the comparative study how it influences. Okay, like this Solomon 4 group design. This is next one is factorial design. In this, researcher manipulates two or more dependent variables. Okay, he will make the changes two or more independent variables simultaneously to observe the effect on the dependent variables. This design is useful when there are more than two independent variables. Okay, two independent variables are there. That time this factorial design can be used, because here the researcher manipulates two or more independent variables. Next one is randomized block design. Control of inherent differences between experimental subjects and differences in experimental conditions is one of the difficult problems faced by researchers in the biological sciences. Okay, for example, subjects, nothing but people. They are divided into women and men. Among women, random assignment, men also random assignment into three groups. Group 1, 2, 3, 1, 2, 3. Then add 1, 2 and 3, compare the reaction. Here also their reaction is compared. Here inherent differences, some like they are human beings, they inherit some genes from the like their ancestors. So where there is inherent differences between the experimental subjects and their experimental conditions, because women different, men are made different, their bodies different, so research result will change between men and women. Those reactions you have to compare. So when coming to the biological sciences, usually researchers face many difficult problems in this type of researches. This is randomized block design. Next, crossover design. Subjects are exposed to more than one treatment. Okay, crossover, more than one treatment, not only music therapy, some pain relieving protocol also is used, music therapy is also used. Like that, more than one treatment where subjects are randomly assigned to different orders of treatment. This design is more efficient in establishing the highest possible similarity among subjects exposed to different conditions. So study participant randomly you will allot to the one group and two group. Treatment A, treatment B, two groups. Where washout period is there, then period 2. Okay. Here they will check treatment B and treatment A. More than one. Okay. Here music therapy they will give. Here some pain medication protocol they follow. After the some period they change the method. For them music therapy, for these people this protocol is followed. Then the post test will be conducted. They will check their reactions or effectiveness of these treatments among the two groups, where groups compared obviously have equal distribution of the characters. So this is called as crossover design. Coming to the advantages of this true experimental design, to establish causal relationship between independent and dependent variables. Mainly here in all the designs we are checking the effect of or any change in the dependent and independent variables. So to establish that causal relationship between these variables, true experimental design will be helpful. The controlled environment in which the study is conducted can yield a greater degree of purity in observation. If there is a controlled environment, researcher keeps everything in his control. If the study is conducted in that controlled environment, it can yield a greater degree of purity. Purity of the research can be observed. Conditions not found in natural settings can be created in an experimental setting where the independent variable is manipulated by the investigator. Okay, the conditions in natural settings you cannot provide, but in the lab where experiment is going on, there the researcher can conduct by where he can manipulate the independent variables. In this approach, we can often create conditions in a short period of time that may take years naturally. Naturally, waiting for that conditions to appear, it takes long time. But in experimental studies, the researcher can create that condition in a very, very short period of time. When experiment is conducted in laboratory, the pressure and problems or real life situations are removed. If you conduct the research in laboratory, the real life disturbances, everything you can remove, and the researcher can pursue the studies in a more leisurely, careful and concentrated way. In the lab, if you conduct, all the external disturbances can be removed. The researcher can leisurely, carefully and he can concentratedly conduct the research study. Those are the advantages. What are the disadvantages of true experimental research designs? The results of experimental designs cannot be replicated in studies conducted on human beings due to ethical problems. These experimental designs cannot be replicated. If you conduct the research design among 30 people and if you want to generalize the result to 1000 people, that's not possible, because there will be problem with ethical problems, because here you are dealing with human beings and checking the effect of some treatment on the relief of pain. That kind of results you cannot generalize for larger population. Many of the human variables neither have valid measurable criteria nor instruments to measure them. In most of the studies, what happens is standard measurable criteria, tools are not available. The instruments are not available to measure their feelings or some pains exactly how they feel. Some standard tools are not available. Then if experimental studies conducted in natural settings like hospitals or community, it is not possible to impose control over extraneous variables. In the hospital or in the community, if you want to conduct there is possibility that the whole situation cannot be under your control. There is a influence of extraneous variables. It is difficult to get cooperation from the study participants because it may involve medical or surgical treatment. Okay, usually in this what happens, you select patients according to your criteria, but when you are giving the treatment or the therapy or intervention, every patient will not accept it like same. Okay, some may react in a different way, some may not accept, some may not be able to tolerate for 30 minutes, they will discontinue at 15 minutes. That type of problems the researcher will face, okay, which may make the prospective subjects reluctant to participate in research study. After observing some people, the others may see that okay, this is going to be complicated, I will not participate. Like that, you may observe rejection. This is one disadvantage of true experimental research design. So these are the advantages and disadvantages. And the second experimental design is quasi-experimental research design. Quasi-experimental research design, it involves the manipulation of independent variable to observe, the effect on dependent variable. So in quasi-experimental design, what happens? It involves the manipulation of independent variable to observe the effect on dependent variable, how it affects the dependent variable. But it lacks at least one of the two characteristics of the true experimental design, that is randomization and control. Manipulation is there, but randomization and control will not be there in quasi-experimental research design. The types of quasi-experimental design are non-randomized control group design and time series design. Coming to non-randomized control group design. In this design, experimental and control groups are selected without randomization. Okay, without random distribution, they will select experimental group and control group. Okay, and dependent variables are observed in both groups before intervention. Both the groups, they will observe the dependent variables before intervention. That is, pre-test will be conducted for both the groups, and treatment will be given to the experimental group, no treatment for the control group. After that, post-test will be conducted for both the groups. Post-test observation of dependent variables is carried out for both the groups to assess effect of treatment on experimental group. Here one thing which is changing is randomly selecting the subjects is missing here. That is non-randomization control group design. Yeah. Next one is time series design. This design is useful when the experimenter wants to measure the effects of a treatment over a long period of time. In this, the researcher who is conducting research want to measure the effect, whatever music therapy or any treatment effect for a longer period of time. The researcher carries out an experiment on an individual or on a small number of individuals by alternating between administering and then withdrawing. Sometimes they give the treatment, sometimes they withdraw the treatment, all under the control of the researcher to determine the effectiveness of the intervention. Here you can see experimental group, only one group will be there, 1, 2, 3, okay, and the treatment will be given. Again, post-test will be conducted. But here, alternatively, they will give periodic breaks in between the treatment administration. Okay, like this, by alternating between administering and then withdrawing, like this changes, everything is under the control of the experimental. That's why, and these are conducted for longer period of time. That's why it is called as time series design. These are the two types of quasi experimental design. They are non-randomized control group design and time series design. Next, third type is true experimental design, quasi-experimental design, and third type is pre-experimental research design. This research design considered very weak because the researcher has very little control over the experiment. So, very little control over the experiment. The types are one shot case design, one group pretest and post-test design. Let's see what is one shot case design. In this design, a single experimental group is exposed to a treatment and observation are made after the implementation of that treatment. Here only one group is there, one group, okay, one short case treatment, okay, experimental group treatment will be given and post-test will be conducted. Here no pre-test, okay. So the researcher's control will be very less in this. One group pre-test and post-test design. Another one, okay, it is the simplest type of pre-experimental design where pre-test will be conducted. Only one group will be there, that is experimental group. Pre-test, intervention, some therapy or treatment will be given. After that, post-test, the effect of the treatment will be tested, but only in one group. A pre-test observation of the dependent variables is made from implementation of the treatment to the selected group. The treatment is administered and finally a post-observation of the dependent variables is carried out to assess the effect of treatment on the group. Okay, this is called as one group pre-test and post-test design. Pre-test, intervention and post-test. Okay, these two come under the pre-experimental research design, one shot case design and one group pre-test and post-test design. Okay. Advantages of this are very simple and convenient to conduct these studies in natural setting, especially in the nursing, and most suitable design for the beginners in the field of experimental research. Disadvantages are it has very little control over the research and considered a very weak experimental design to establish causal relationship between independent and dependent variables because it controls no threat to internal validity. Okay, these are the disadvantages. It has very little control and considered a very weak experimental design. Okay, important steps are missing in this, so it is called as a very weak experimental designs. Okay, so in today's class we have seen the classification of the research design. Okay, qualitative research and quantitative research. In quantitative research, experimental. Okay, in that we have seen a true experimental, quasi-experimental, and a pre-experimental designs. Thank you for watching. Like, subscribe, share with your friends. Motivate everyone to watch the videos for more information. Thank you.